Thank you for watching KTN. Welcome back. This is The Impact, where we're looking at the state of healthcare in Kenya. Many thanks to Ian Ketenye as well for bringing us up to speed on the bulletin right there on KTN Prime. In studio with me is George Gibora, who's the Secretary General Kuko, Karibu Sana, as well as Dr. Abidan Mwachi, National Chairperson KMPDU. We have Brown Ashira, Secretary General Kepu, Karibu, as well as Dr. Brand Lishanga, Chair Rufa. Now, when we went on break, there was the discussion that we were just having in terms of our doctors' numbers. But I want to come to you, George. We want to look at how we finance our facilities. We want to look at inefficiencies that are there in the entire health sector. Where are we playing at? From where you sit as a practitioner, which are the misses that we are not handling in the entire system to ensure that Kenyans access the quality healthcare promised by Katiba?
Thank you. I think that's a very brilliant question, the inefficiency in our health system. And one of it is where we started in terms of discussing the funding system in our country. And we have clearly indicated that whichever is there, whichever we contribute toward SHA is not enough. And to the extent what has been also provided through taxation, where we get government appropriation, it is not enough. Because the government themselves, through their own projection, even under how they were to package, they were putting together close to around 250 billion as a start-off to ensure that now SHA can function fully. But we have never been closer to that. And always whenever the ministry project what they require, it can be reduced by Parliament. And to that extent, it totally affects the service delivery, and we are not able to have full functional facility. I must say that it points out to also the governance system that we have in our country. There is a lot of inefficiencies. You understand that our system is like the public system. We have the national government and the county government. With that level, there have been a lot of disquietness where the Minister of Health versus and the Council of Governors are fighting. They are in a fighting mode. They are never in agreement. This affects service delivery. Let me put a specific issue which we currently have that has been revolving year after year, going through several financial. The issues of the healthcare workers, more specifically the UHC staff. That they were employed by the national government, were being paid by the ministry, working at the county level, and they have been on contract for more than 6 years, several renewal, despite the employing entity, which is the Public Service Commission, advised otherwise, that put these people on permanent and pensionable, and even the presidential declaration. Up to date, these guys, some of them already their contract has expired, but there is nothing. It is still there is still fight between the Minister of Health who is to do what and the national and the county government. Remember, this issue has led to national strike, several national strike, affecting service delivery. So we feel that that point out to that we need to do an audit of how have we managed our health system since we gave ourselves the new constitution. And our pinpoint to this is that we need a central managing system that can manage the healthcare workers. More specifically, to ensure that we can employ whenever we want. They can mobilize resources specifically for employment. Because even the president, before they came in, they promised to employ 20,000 healthcare workers. To date, when they proposed to the counties, county said, give us the money. Then the president being him, he knew that very well, that if you give the counties, they will not choose the money to employ. So nothing has happened up to date. It's a promise that is far-fetched.
Okay.
Now, so that I finish my thought. So what that means is that we have counties and the national government that do not speak the same way. Despite learning, even through COVID, we have not learned that there are things that we must centralize to ensure that the system is functioning. Thank you.
Let me come to Brown.
Yes,
Brown,
yes.
we've talked about the inefficiencies that are there, right? And it points to the fact that the president talked about this when he went and even met with the healthcare during the campaign period. You know, we have the Public Service Commission as well that has given its own recommendation on what needs to be done. We seemingly know where the problem is, but intentionally don't want to address it. Is that the fact? Is that the position for Moya, you said?
Number one, I would say, I'll be very quick and very straight. One, we must rethink on how we do our financing and budgeting in this country. Believe me, you and me, nothing can work in this country without financing. The budget, the whole component of financing has to be looked at. And when I say like this, I mean even the budgeting at the Ministry of Health has to be balanced. We have the clinical and the preventive aspect. Let me tell you something. The real health crisis in this country might not even be in the hospitals, might be in the environments we live, might be in the food we eat, might be in the houses we live in. Because remember, most of the issues that are actually affecting us are in the environment. We have a lot of social determinants of health. How many people are bold enough to address issues with social determinants of health? Is the Minister of Health bold enough to put monies in public health? Because sometimes we fail to understand, when we're talking about budgeting, we actually skew it towards clinical, and then we forget a very important component on public health and community health in this country. I want to thank the President, because at one point, he has actually given some life to community health promoters. But we know that is not the solution. We need to go beyond and ensure that public health officers and other healthcare workers in this country are protected enough. Coming to a point, you know, sometimes the issue about the people who speak loud, and I think I want to agree with most speakers. Sometimes they say the people who speak loud might not be having the solution. They can be the problem causers. The president need to come. The House must face surgery. And I say it's right from the leadership. We need people who can speak the talk. We need people, leaders at the House who know, who can be able to fix the problems that are actually affecting the health sector in this country. And the HRH component, I can even attest to you, the issue that Geboro spoke about, the UHC. Let me tell you, we have had the UHC colleagues sitting there for over 6+ years. Money is coming. I heard the CS, the Honorable CS, saying that by end of June, they are actually going to extend again their contract to actually end of June. When you actually supposed to be talking about confining them to permanent pension. These are people who have been languishing, and I want to say that we need to fix that problem. Lastly, allow me to say this. The public health landscape in this country must be looked at. Let's ensure that we get things right from the household, we get things done right. Actually, if we were to fund and finance public health activities in this country, at the level 4, 5, and 6, we'll actually have lesser patients. And the cheapest bed in the hospital, let me tell you this, is the bed that does not have a patient. That's the cheapest bed in the hospital. Our workers' PHOs is to decongest those hospitals and ensure that we have issues fixed from the community level and also from the primary level.
You know, we talk about healthcare in the country, and majority of it has to go towards, how I look at it, has to go towards preventive medicine, you know, because we don't want to have people getting in to be treated. And it points directly to that. Because the other day we were having a conversation on even the boreholes that we have in our houses, right? And there is no set-up policies that would ensure that the water that you drink in your house passes the standards that have been laid down to prevent you from going to hospital. That is the larger component of it. But you seemingly are interested on matters to do with Linda Mama level 2s and level 3. And with that then, what are we seeing to be the failing points, to be the low-hanging fruits that we are not taking advantage of, that is then in the inverse exposing women, exposing our mothers to problems?
So Dennis, let me just tackle the preventive medicine. I agree with you. As a family physician, I understand very well that, you know, they are the downstream determinants of health. So people don't fall ill when they are in the hospital. They fall ill at home, within the community. Now, where is the rain beating us? We have a benefits package under the Social Health Authority that is, in my view, progressive. very different from what we had under NHIF. For instance, now we have a package for screening, okay? Screening for cervical cancer, screening for prostate cancer. You know, we have sickle cell package. We have several provisions, even breast cancer screening. We have some benefit package for chronic illnesses, for diabetes, hypertension, cardiovascular disease, you know, these kind of things. Why is it that Kenyans are not experiencing, you know, cervical cancer screening? Our women are not, this is not happening. I will still go back to the same point. The package is there. If you look at the budget policy statement for this year, just this year, yes, okay, the budget policy statement says very clearly that we need 73.9 billion Kenya shillings to deliver the gazetted benefits package, not the imaginary one. The gazetted. The one that we have gazetted and agreed as a country that these are the benefits that Kenyans should get. We need 73.9 billion. The same budget policy statement says that based on a registration only, we are going to reduce that 73.9 billion to 38 billion. Okay, so we are saying today, based on the registrations we have, to deliver this preventive care that you're talking about, plus many other things, we need 38 billion. Guess what Parliament has put in the budget for 2026-27? They have put 13.1 billion. Less than half, 34% of what is the actual requirement for you to deliver preventive medicine. Now, do we have clinicians in this country who know how to do a pap smear or know how to do HPV DNA? In fact, for DNA testing for cervical cancer, we have a very good proposal to put it in the CHP kit because it's a simple test tube vial. We put it in the CHP kit. When they are going to see women in the mashinani, they test them for cervical cancer. Why are we not doing it, Dennis? Because we know very well we need 38 billion shillings, but we are approving 13.1 billion shillings. That 34% means a Kenyan woman somewhere will not be able to get essential breast cancer screening, cervical cancer screening, prostate cancer screening. This is a fundamental problem. Now, even the Linda Mama that has been reintroduced after we have spent so many years saying that women are dying because of maternity access, that Linda Mama has no budget line within this year's budget. So we introduced it 2 days ago, and we said now women can go and deliver at level 2 and level 3 for free. But guess what? There is no money to pay for that service. Now, bring you to a very interesting point. There is an over-enthusiasm to fight imaginary problems within the health system. Now, I don't mean that these problems are minor. For example, take the problem of medical fraud. We have quantified it. We know that between 15 to 24% of all medical claims are suspect, which tells you that somewhere between 76 to 85% of claims are clean. We spend so much time fighting that, and guess what we did? Because we have a problem with this 15% and 24%, last year in July, we wiped out 3,479 delivery beds out of the system. Today, you can go to a health center in Kenya, in labor, a woman can go, there is a maternity bed there, but she will be told there is no bed, because there is no bed in the portal. Today, we have wiped out 1,089 delivery beds, the ones where you actually deliver, which represent 20% of all delivery beds in Kenya. They are available in our dispensaries, but women cannot access them unless we confront these problems. The over-enthusiasm, the laziness of Parliament, the national government and treasury treating healthcare as the unwanted child. We are funding everything, but we are not funding healthcare.
That points directly to matters to do with governance, Dr. Abidan. And we talk about governance, and I want to look at it from the top going down. You know, the president and the policies that he gives, directions he gives to his cabinet, to his minister, and that goes to the PS and everybody in that chain. Are we looking at a situation where the governance structures in the entire health system is just broken? If we fix that, then are we able to say that if that is fixed, the healthcare system in the country will be something for us to be proud about?
Healthcare is a very delicate system, and it is not completely astute to discuss healthcare in silos and imagine that once we concentrate all our efforts into one aspect of healthcare, then there will be a domino effect to fix the rest. One aspect of the pillars of healthcare does affect the other pillars directly and in a manner that will render now the entire end product almost null and void. Now, having said that, it is true to say that, sometimes, and many times actually, in this country, we do announce policy matters before we even try to operationalize them. And at the very stage of problem identification and root cause risk analysis, we don't do due diligence because we base our policies on sloganeering. Now, medicine does not respond too well to sloganeering. From where I sit, the entire healthcare system being as sensitive as it is, it should be known that any deviant discussions out there in public are likely to affect health-seeking behavior. Right. However, there are issues that we must discuss because they are the elephants in the room and they are obviously they are obvious issues to be talked about, and whether we word them out or not, they are there to be seen. And that is the lopsidedness in our policies as concerns to healthcare hiring. In a country where we have a very big deficit of healthcare workers. Actually, we only meet about 75% of our healthcare needs. We still have doctors languishing in unemployment while we are training about and releasing about 1,200 doctors every year. And why is this the case? This was informed by a roadside declaration, a roadside policy that was made in 2017 in a reaction to a strike by the doctors, and it has never been revised to now. While counties are being innovative and trying to come up with a brick and mortar, the white elephants, we call them, it has to be known that the root, the bullseye of the sector falls onto the hands of the healthcare provider. We might have all the ceilings, we might have all the money, all the coffers in the bank, just as they say about wealth and everything. But for as long as we don't have the healthcare worker employed and deployed, healthcare will not be provided by money.
Ladies and gentlemen, healthcare in the country is a very serious matter. It is, to many, very emotional. We just had a story of our very own here who lost the father on the bed. It is a story of all of us going in there and not being able to access healthcare. What's the status? We've been told. Solutions are there. What we must do in terms of financing, in terms of leadership and governance that must be applied for us to have a healthcare system that we will be proud of as prescribed by the Constitution of Kenya 2010. I want to thank George Gibore, who's the Secretary General for KUKO, for making time to be with us. Brown Oshira, Secretary General, Kenya Environment, Health and Public Health Practitioners Union, Asante Sana, as well as KMPDU Chairperson Dr. Abidan Mwachi for being here, and Brian Leshenga, Rufa Rural Urban Private Hospitals, who has made it all the way from Kakamega to be here and have this conversation with us. Nosema Asante Sana. The conversation definitely must continue. But remember,